Hello, welcome to this webinar on AccessSurgery. Can everybody hear me and see my screen? Please let me know using the chat box. When joining the presentation, everyone is muted, so if you have any questions as we go along in today's session, please just chat me your questions and a colleague of mine is standing by to answer those for you. My name is Wesley Holloway. I'm a digital platform trainer and health sciences librarian with user services at McGraw-Hill. In today's session, we will talk about what AccessSurgery is and some of the content that you can access in the site, including some of the leading textbooks in surgery, great surgical, quick reference, clinical reference items. We have a drug monographs tab that I'll show you. There's some great multimedia in the site, including procedural and conceptual videos. We have some tools for case-based learning. We have some real-life patient cases that can be very helpful that we'll look at today. We also have several study tools that are great for self-assessment for board review and board preparation, including for the ABSITE. We'll also take a look at some of our surgery clerkship materials as well as patient education handouts. And toward the end of today's session, we will circle back to this support tab at the top. And this user resources button is where you will find all of our additional helps and supports for using the site, including user guides, tutorials, videos, handouts, and more. If you scroll to the bottom of AccessSurgery, we include a tab with more information about AccessSurgery, including our advisory board, where you can read more information about those board members. AccessSurgery introduces a whole new dimension to surgical education and clinical practice. It provides medical students with a variety of resources needed to excel in their surgery clerkship, assists residents in gaining instant access to videos, self-assessment, and leading surgical texts, establish an important foundation for learning, and allows practicing surgeons to brush up on their medical knowledge when studying for their maintenance of certification exam. It is a unique and indispensable tool for your surgery program or library's collection, in that it offers some of those leading texts in surgery, including Schwartz's Principles of Surgery, 11th edition, and also Zollinger's Atlas of Surgical Operations. AccessSurgery is a unique site in that it offers indispensable support to resident education and clinical practice with interactive features. Again, it provides some of the leading surgical textbooks, as well as instructional videos, which includes a unique collection of surgical videos and animations that go inside the anatomy to show step-by-step how to perform basic and advanced surgical procedures demonstrated by some of the world's preeminent surgeons. AccessSurgery also includes over 16,000 high-quality, full-color images. It is truly an extensive collection of images that are offered in the site and that assist with a visual diagnosis as well as step-by-step procedures. The site also provides interactive board review with more than 3,000 ABSITE style review Q&A designed to help residents and clerks prepare for exams. It also includes an integrated drug database as well as clerkship-specific resources. AccessSurgery is mobile optimized for viewing on any mobile device, so you'll have access to all of the content, the same as when you are viewing it here on the desktop. When trying to access the site, be sure that you authenticate with your institutional subscription to AccessSurgery. Usually you will need to navigate through your library's website, or you'll need to be connected through a VPN, or other means that will authenticate you with the institutional subscription. And when you enter AccessSurgery, please use the sign-in feature in the upper right and either create your free MyAccess profile or go ahead and sign in. If you already have your profile, this is a free sign-up. And once you are logged into your MyAccess profile in the site, you'll notice your name in the upper right here, and out beside it, your institutional affiliation. The MyAccess profile is really important for you to be able to utilize all of the functions and features here in AccessSurgery. With a MyAccess profile, you can start and select content to add to your favorites, and these favorites can also be organized into folders just for better organization. So if you were in a certain class or if you are teaching a certain class, or if you're working on some sort of research topic or have some sort of topical interest, you can create a folder and organize resources that we have in the site into these different folders. We also allow you to track on your history, so you can see all of your recently viewed content. If you inadvertently become disconnected, you lose internet connection, your computer dies, you can just sign back into your My Access profile, and you can view your history and resume from where you last left. You can also see your review questions. This will allow you to track on your self-assessments that you take either through our case quizzes or our review question quizzes, and you can rename these quizzes using the rename tool. This is helpful for instructors if they ask their students to have some sort of naming convention for their assessments that they submit. And you can of course see the site that you pulled the content from, the date it was last accessed, your score, as well as the option to retake those assessments. You can also track on your case content, any of your case progress in the site, including cases that you have viewed or completed. You'll see your case title, the resource that you pulled the case from, and the site and the date last accessed. You can also track on your CME here in AccessSurgery. Our CMEs in the site are really designed for physicians to answer clinical questions with some current and relevant data that improves patient care. Our activities in AccessSurgery have been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint providership of the Interstate Postgraduate Medical Association and the McGraw-Hill Companies. And I would encourage you also to read more here about our CME, to learn more about actually tracking on your credits, how to claim those credits, and what the process is for that. Lastly, you can also view your settings options for your profile. This allows you to edit your profile information and your password, and you can also set up alerts to receive an email notification for any of these sites that are in your subscription. It is just a simple email notification letting you know when any new content has been updated in the site or has been added to the site. And using the McGraw-Hill Medical drop-down in the upper left, I can navigate to all of the McGraw-Hill Medical subscriptions that my institution subscribes to. They'll all be listed under the Available Sites heading. You may also notice another heading. It might say Explore Other Sites or Other Sites, and those are the resources that are outside of your subscription. On the homepage of AccessSurgery, you can scroll through this textbooks carousel that we have. This will give you a short snapshot of some of the different texts that are available on AccessSurgery, and we will of course take a look at the full library of all of our text resources found under the Books tab. As we scroll, you'll notice 3 different tiles here. These are some of our rotating tiles where we highlight different resources from the site. So here we have some supplemental content from our Behind the Knife podcast series, and we will take a look at the Behind the Knife podcast later under the Multimedia tab. You can also see our curriculum and weekly quick test, where we provide supplemental content in addition to the material that you can access here on AccessSurgery. And then we also have a video from Zollinger's Video Atlas of Surgical Operations, and we'll also take a look at that resource in more depth under the Multimedia tab. It is a new resource and a new format that we have available in AccessSurgery, where the video is displayed in text, so you can actually see the procedure alongside the written concept. On down the page, you'll also see a snapshot of your My Access profile, as well as new content that we have added on the site. So we have just updated with a new current diagnosis and treatment text for surgery, now in its 15th edition. You'll also see popular chapters on AccessSurgery. AccessSurgery also has a search layer that will allow you to search for a topic in the site. By default, you can search in the AccessSurgery site itself, or using the drop-down menu to the left of the search bar, you can expand to run what is called a federated search. You can search your topic across all sites, including those that are outside of your subscription. As you type, Notice the auto-suggest that appears. That is to help guide you in your search. And for knee replacement here, I see 70 results. We also provide another hyperlink in the set of results in AccessSurgery, which link out to the federated search results. Again, that's just a way of broadening to find more results. To the left, you can use this search builder to further modify and focus your search if you need. You can add additional search terms by keyword, title, author, or ISBN. You can also filter your results by format type, book chapters, cases, patient education, clinical, quick reference resources. You can also narrow by certain textbooks. So these are the set of texts that are being yielded in this set of results. You can also narrow by topics, which is a great tool to help you focus your search as well. Out to the right of each item in our search results, you will see this star icon. This will only appear if you were signed into your My Access profile. And anywhere you see the star icon throughout the site, on any multimedia item, chapter, textbook, case, review content, and more, wherever you see the star icon means you can add that to your favorites in your My Access profile. And so you can add it to an existing folder that you have, or you could even create a new folder to add the content to. Let's take a look now at our library found under the Books tab. All of the books in AccessSurgery are organized by categories out to the left in this table. So you can see the different surgery-related texts by these categories, these topics, these conceptual and physiologic areas. We also include an archive of all of our textbook resources, so any previous editions will go to live on this page in the site. You can filter our text by those that are CME eligible. And you can also view an exportable list of our resources. That is a downloadable Excel file that includes every title. That's usually very helpful for librarians. The Schwartz's Principles of Surgery text is now in its 11th edition. This book is celebrating 50 years since McGraw-Hill first published the edition in 1969. And it is still regarded as the cornerstone textbook in general surgery throughout the world. The book's first editor and namesake, Seymour Schwartz, remains active as a distinguished alumni professor in the Department of Surgery at the University of Rochester, where he regularly attends grand rounds at the age of 92. Dr. Schwartz wrote a historical perspective on the vast changes in the practice of surgery and medicine that he's witnessed in his 65-year career as a surgeon. This 11th edition features a distinguished team of editors and authors as well, including the first female surgeon to edit a major general surgery textbook, Dr. Lillian Cow, who also co-wrote a timely new chapter here on web-based education and implications of social media. Here on the text, you see that we can continue to search our topic, knee replacement, and it will search just that topic within this textbook. Out to the right, you'll see our star icon where we can add this text to our favorites. We can also view any relevant multimedia that is being highlighted here. So any concepts such as kidney transplant or right colectomy, all those videos are also complementing what is available in the text. We can also use these show hide chapters to expand the different sections here in the text and view all of our different chapters. Other chapters that are new to this edition include Optimizing Perioperative Care, with a focus on enhanced recovery in Chinese medicine. We also have Understanding, Evaluating, and Using Evidence for Surgical Practice, Ambulatory Surgery, as well as Skills and Simulation. Along the top of each chapter, you'll see our breadcrumbs to help track your place, including jumps to previous and next chapters. Again, the star icon to add this chapter to your favorites. I do want to quickly point out that all of the textbooks in AccessSurgery, including each chapter and each chapter section, all come enabled with durable URLs that can be copied out of the browser when you're on that item, and those can be embedded in a learning management system. This is a really great tool for faculty who want to integrate our resources into their coursework. So it would take students directly from their LMS to the content here in AccessSurgery. And again, that's every textbook, entire textbook, each chapter, and even sections of chapters. They all come enabled with durable URLs. The chapters are organized using this chapter taskbar. You can jump to particular sections. These also have their hyperlinks, again, durable URL enabled. You can print and save this chapter as a PDF or just save it to your desktop or elsewhere. And please be on the lookout soon for the PDF icon button that will begin appearing. That is a new feature where you can print a PDF of the chapter directly. You can also share this item through email or social media, as well as generate a citation using AMA, APA, or MLA citation styles, or you can generate another citation style using one of these reference management tools. Chapters are also organized as the full chapter, which is all of the text, figures, images, and tables. But we've also broken out our figures and tables into separate tabs just for ease of access. And if you are signed into your MyAccess profile, you can add it to your favorites. You can download a PowerPoint slide of our figures, which includes the full citation, or you can view the figure in full size, which also allows you to print the figure. All of our tables can be downloaded as PDFs. You can also view them in full size for printing, or you can add the item to your favorites. And we'll take a look at one of these tables just to give you an idea. And the link at the top will take you to that table in the text itself. If we look back at our full chapter, you'll notice along the top of each section this listen icon. So here is another section where the listen icon appears. And this is our Read Speaker Text-to-Speech tool for auditory learning styles, as well as to make our sites more accessible to more users.
Surgical anatomy. The esophagus is a muscular tube that starts as a continuation of the pharynx and ends as the cardia of the stomach.
And you can see that the sentence that the Read Speaker tool is reading is highlighted in green, and the word level itself is indicated in blue. We can adjust these settings using the little gear icon, and we can choose our text highlighting options, including colors for word, sentence, and text. And if we are not sure what something is, such as enhanced text visibility, our help icon will provide you a short description of that item and what it will do for you. You'll also see automatic scrolling and reading speed options here. And you'll also notice that as I highlight any portion of the text, this Annotate button becomes enabled. We know that a lot of users like to write in their texts and to be able to create their own notes. So we have embedded the Hypothesis annotation tool into our texts. You'll see it here embedded up in the upper right using this arrow icon. You can expand the Hypothesis sidebar. Hypothesis is a separate sign up from your MyAccess profile, although you can use the same login credentials, but it is also a free sign up in the site. And again, if I select Annotate, anytime I highlight any portion of that text, you'll see the portion of the text that I'm annotating provided above my notes pane here. And you'll see different text options available to me, including the option to insert a link if I wanted to link out to a YouTube video or other content here in AccessSurgery or Access Medicine or our other sites, or from somewhere in the internet in general. I can do that. I can add tags to make my posting more searchable. I could also post it publicly or privately. And Hypothesis is also great for group work. You can create private groups that is shared through the email that you use when you sign up for your free Hypothesis account. This can be great for classwork for a lot of instructors if they want their students to discuss the class text. So an instructor could have a private group and invite all of the students to that private group, and then using the embedded URLs, assign this reading to students, and then have them to comment on the readings, including comment on each other's posts, and that really helps to facilitate a class discussion over the course readings. and also a great way even for a flipped classroom approach. It's also great just for students or researchers who want to collaborate with one another and share their notes. Of course, it is great for that as well. I want to point out a few other texts back in the library. There are many great textbooks here in AccessSurgery, and I really hope that you will explore more of the library here and some of our different resources. But I do want to point out this Atlas of Minimally Invasive Surgical Operations. This exciting new addition to AccessSurgery covers step-by-step instructions to 62 procedures in minimally invasive surgery, or laparoscopic surgery as it is commonly referred to. There are nearly 1,000 detailed illustrations by two of the most talented surgical illustrators in the business, Corey Sandone and Jen Fairman, and they are both from the Department of Art as Applied to Medicine at the Johns Hopkins School of Medicine. The lead editor, John Hunter, is one of the most prominent figures in the development of minimally invasive surgery over the past 2 decades, and he has assembled an all-star cast here of associate editors in thoracic surgery, abdominal surgery, colorectal surgery, bariatric surgery, and other surgical subspecialties where minimally invasive surgery is being widely adopted over open surgery due to its smaller incisions, quicker patient recovery, and importantly, shorter hospital stays and reduced costs. And these procedures cover indications, preoperative preparation, anesthesia, position, incision and exposure, closure, and postoperative care alongside the step-by-step illustrations. The book also covers important principles of laparoscopic access, minimally invasive suturing and knot tying, and other advanced topics like robotics, single incision laparoscopic surgery, and natural orifice transluminal endoscopic surgery. The content will appeal to all residents and practitioners in general surgery, as well as those in all surgical subspecialties who wish to incorporate minimally invasive surgery techniques into their practice. If we look back in the library, another text I want to point out to you is this Cardiac Surgery in the Adult, now in its 5th edition. And so this text was edited by Lawrence Cohn, who sadly passed away during the final stages of development of this edition, but who was a preeminent cardiovascular surgeon and emeritus chief of cardiac surgery at Brigham and Women's Hospital. Dr. Cohn edited the book since the 2nd edition in 2003 and was best known for his pioneering work in minimally invasive valve surgery, having performed more than 11,000 open heart surgeries. David Adams took over as editor during the final stages of this 5th edition. Dr. Adams is a cardiac surgeon-in-chief of Mount Sinai Health System and professor and chairman of the Department of Cardiovascular Surgery at the Mount Sinai Hospital. Cardiac Surgery in the Adult has been cited by the Journal of Thoracic Disease as the most referenced textbook in adult cardiac surgery, and it is well known in the field for its state-of-the-art approach to rapidly changing innovations in surgical techniques and strategies for the treatment of cardiac diseases. In the 5th edition, the world's foremost cardiovascular surgeons once again deliver thorough, up-to-date coverage of operative strategy, decision-making, techniques, and pre- and post-operative management for treating the adult cardiac patient. Unmatched in both its scope and clinical rigor, this classic text contains 63 chapters that highlight every important topic in cardiovascular surgery. And another text I want to point out to you is this Surgical Patient Safety, a Case-Based Approach textbook. This is an exciting new book available on AccessSurgery. Publishing on topics like patient safety is key to our strategy of aligning our Access medical content with the needs of community hospitals, and surgical patient safety is a vitally important issue across all hospital systems, both large and small in the United States and around the world. Contributors to this book represent a wide range of stakeholders in surgical patient safety, from surgeons in different surgical subspecialties to medical students, residents, medical educators, healthcare communications professionals, and patient safety administrators. This book presents practical tools for surgeons in training to use, including the use of safety checklists, communication and decision-making strategies, and tools to confront surgical complications and errors. It includes valuable case studies that are also presented and written from the perspective of different surgical subspecialists, including thoracic surgery, gynecologic surgery, abdominal surgery, orthopedic surgery, and trauma surgery. Its key features include some of the latest practical patient safety tools for surgeons in training, including surgical safety checklists, intraoperative or rescue strategies, and the global implementation of new regulatory compliance guidelines. This text also includes case-based scenarios that examine technical challenges and bailout options in the operating room. It also has bulleted format pearls and pitfalls that take you through the decision-making process for the diagnostic workup and revision of specific complications. This text also includes insights from renowned experts that explain how to handle with malpractice lawsuits, navigate the modern dangers of electronic health records, apply the pragmatic IKEA approach for patient advocacy, and much more. It is really a must-read for all practicing surgeons, independent of their surgical subspecialty. Under the Quick Reference tab in AccessSurgery, you will find more of your clinical reference items that are great for a quick lookup. We do have the 2-Minute Medicine Surgery, and this resource provides some daily literature reports out of the Harvard Medical School. These literature reports curate all of the different surgical literature that is available and helps to really make it more of a succinct place for users to come to keep abreast of all the developments in the surgical literature. You can search these different reports, and you can also read the actual report itself, including a link back to the article that is being reported on. So here we see the link to view the original article, which may be respective of paywall boundaries. And then we have the report that breaks down the study. So a study rundown, some in-depth analysis, but it's just a nice quick way to sort of keep up with the surgical literature. We also have this quick answers text. This text is focused on surgery. It is searchable. You can also browse alphabetically. This is a diagnostic index of over 100 symptoms and signs. It provides clinical point-of-care information that is easy to understand and digest in this bulleted format, so it really is conducive to a quick lookup in the clinical setting or at the point of care. It includes clinical findings, epidemiology, diagnostic considerations, workup, treatment, management, and also references with links out to the PubMed literature. Also under quick reference, we have this ABSITE quick review. So this is our ABSITE Slayer text. It is also searchable, as you can see. This is the ultimate preparation tool for the American Board of Surgery and Training examination. ABSITE Slayer is a rigorous, high-yield review that focuses specifically on the American Board of Surgery and Training examination, designed to reduce pre-test anxiety and help you achieve the highest score possible. This powerful study aid provides a complete framework for your exam preparation. You'll find everything you need to ace the exam in this one package, from Q&A and full-color illustrations to tips, all from expert authors who know exactly what it takes to excel on the exam. And here is why this is the best ABSITE review available. It includes more than 300 multiple choice questions and more than 1,000 quick hit single answer questions. It includes test-taking tips that spell the difference between success and failure on the exam, numerous full-color illustrations of must-know anatomy, valuable clinical pearls, easy to retain in its format, and it also includes logical, organ-based organization that includes chapters on pharmacology, anesthesia, cell biology, and fluids and electrolytes and nutrition. And you can see the other chapter areas that are available here. Also under quick reference, we have a differential diagnosis tool. And using the table here, you can select a symptom or disease and get access to differential diagnosis information. You can further break this out by the different arrows to view more common or less common signs, symptoms, indications, with links to read more. AccessSurgery also has an embedded drugs database. This drugs database is updated every 2 weeks, providing you with the latest and most accurate authoritative information on drug data. This is our integrated drug database with thousands of drugs organized by generic and trade names as well as drug classes. And these monographs are detailed, containing standard drug data as well as any special notices including FDA warnings. The drugs database here is searchable. And you'll notice that as I search, I also am presented with the auto suggest. You can also browse alphabetically. Selecting a drug, we can see some of our detailed monograph data. You'll see images. Here we see those medication safety special alerts, medication safety issues. We also see international brand names. We can see some general clinical pharmacology data, warnings and precautions, dosing by different population types, so adult, geriatric, pediatric, considerations for pregnancy and lactation, for example. We also have U.S. pricing information available here. We have some general patient education as well. So what is this drug used for? What are some of the side effects? That can be very helpful. And we also have these patient handouts that are organized alphabetically here. They are available in English and in Spanish. These are written at a very general level to ensure that your patient will be aware of how to properly take their medications as well as any side effects that they may encounter. Under the Multimedia tab in AccessSurgery, you will find a great collection of videos. These videos include procedural and conceptual areas, and they are organized out to the left. As you can see here, we have airway management, bariatric, basic technical skills, and the list continues. Trauma and burns, transplantation, vascular, gastrointestinal, upper and colorectal, endocrine, cardiac. So a lot of really great video content here in the site. And I do want to reiterate that these videos, all the content found under the Multimedia tab, including these videos, are durable URL enabled. So you can actually embed the link from the browser, just copy and embed the link into a learning management system, and that is just the browser URL on this video, and that would take your students directly to this item from their LMS here to the item here in AccessSurgery. So it is a really great tool for instructors for embedding multimedia into more traditional learning concepts.
While there are many types of laryngoscopes available, this narrative will only discuss basic principles of direct laryngoscopy using a curved and a straight blade laryngoscope.
And these videos are chapterized, so you can easily jump to specific sections here. We have preparation, techniques, troubleshooting.
The patient's head and neck is placed in a sniffing position. The laryngoscope handle is held by the left hand, while the right hand is used to open the mouth, while ensuring that the lips and teeth are clear of the blade.
So I do encourage you to look at our videos library. We also have Zollinger's Video Atlas of Surgical Operations. In 2018, AccessSurgery debuted a new video format which allows videos to play in place in the text instead of automatically opening in a new window. This is a valuable format for complicated surgical operations and allows users to refer to the accompanying text and anatomic illustrations while viewing each step of the operation. And I'll give you an idea of what we're talking about. So here within this portion of the text, we have our different sections that we can expand. Here we see operative preparation, incision, and exposure. We have different steps available here. And so here embedded within the text, we have this video. And these short video clips will be published for every key step in an operation with the full video available at the end. The videos are narrated by the surgeon as they review the key steps that surgical residents need to learn and be aware of, and each step of the video usually is around 30 seconds to a minute in length, with no more than 5 minutes to maximize use by surgical residents who prefer shorter, high-yield videos when preparing the night before a surgery.
Attention is first turned to the splenic flexure, which is mobilized off the left lateral sidewall. This will expose the retroperitoneum and gyrotous fascia, under which the adrenal gland will lie.
Really great resource here in AccessSurgery. We also include this Behind the Knife. This is our podcast series. It's a leading podcast for surgical education. It includes a large following among general surgery residents and faculty. 20 recent episodes covering reviews for the American Board of Surgery and Training Examination, which residents take every January over the course of their 5-year professional training. Other episodes cover mock oral board exam questions to help residents prepare for the difficult ABS board certification that they take at the end of their training. And we will continue to add more episodes and collaborate further with BTK to tap into their network and increase our episodes available here on AccessSurgery. Again, AccessSurgery is a mobile optimized site, so you can navigate to this podcast through AccessSurgery on your mobile device and listen on the go. And another resource I want to point out to you under the multimedia are the patient safety modules. These online modules will provide you with an introduction to some of the core concepts of patient safety in an interactive and self-paced learning environment. We have different topics covered, but primarily they cover hand washing, understanding error, and communications concepts. And you can see this module is navigable out to the left in these different chapters. And here we see our first module over hand washing. A short quiz is available. So it's a really great self-assessment tool as well. And under the Cases tab in AccessSurgery, we provide materials for short, targeted, case-based learning that require students to think critically about the content. They vary slightly from these different case resources, but in general, you'll get a patient history, an overview, a systems review, some short answer questions or a quiz, clinical pearls, and references. And these cases in AccessSurgery are really geared toward advanced users, including residents and those preparing to take board exams and those who are specializing. So here, for example, we have orthopedic surgery. Out to the right, you'll see your key, which indicates any cases that are unopened, those that have been viewed, or those that have been completed. And you'll notice again your star icon out to the right that allows you to add this case to your favorites in your MyAccess profile. These cases are based on real-life patient scenarios. We're provided with a case overview, including an approach, which also includes key definitions, objectives. We'll even see evidence-based practice clinical recommendations and other clinical data. Here we see our clinical pearls. These are the key takeaways from the case, as well as these references with links out to the PubMed literature. And we also see a comprehension quiz. The results of these quizzes can be emailed, so students or users in general can share the results of their case. They can view the correct and incorrect answers along with short answer explanations, which help to reinforce learning. And these case quizzes can be retaken, and you can email these results as from a student to an instructor. I do want to point out that all the cases here in AccessSurgery are durable URL enabled. So if an instructor wanted to paste the link to this case in their LMS to assign this case for completion, they could do that. You'll also see this case file series on surgery, So you'll notice a very similar layout here as well. And I do also want to point out that you can view these cases by case number. That's a way of challenging yourself so that you don't see the topic of the case beforehand. And again, keep in mind that you can resume work on these cases in your My Access profile. So if you want to resume any progress that you have, you may do so from your My Access profile. You can save your answers and return to work on this case later. And the other cases that we include here, we see these general surgery examination and board review cases. These are based off of this review text to include the case presentation and overview, as well as a quiz and references. You may notice just a slightly different layout here with this case, and it will vary just somewhat from case to case. You'll see the resident readiness cases. These are really geared towards surgery residents, so a little more advanced users. So these include the case overview here, as well as questions. These are just some of our open-ended questions. You can show the answers for those. Tips to remember, some of the pearls, some of the key takeaways, and again a comprehension quiz. And these are the types of quizzes that the results can be emailed and shared. Under study tools, our users will find different items that can help with board review and preparation, including our review questions texts. These resources are really great for self-assessment. They provide multiple choice quizzes that you can generate in a random or custom quiz style. These are some of the text resources that you can generate quizzing from. So here we have Schwartz's Principles of Surgery, ABSITE, and Board Review, now in its 9th edition. This is a really great text resource with over 1,100 questions available. You can create a random quiz or a custom quiz. And here you can see some of the custom quiz areas. Also, under study tools, you can use this Play Showdown. This is a gamification tool that we have embedded in the site. This is where you can challenge your colleagues, peers, or others on their surgical knowledge quiz bowl style. You and your opponent will compete through 2 rounds of questions, each with 5 categories ranging in point values. Like other turn-based games, you can play live or you can opt in to get email notifications when it's your turn. You could also play with the computer, and it just really helps to hone your skills. Here we can continue any games that we had started previously. And here you can see the different point values as well as the categories. We can give up and have the answer revealed to us with a short answer explanation. So the Play Showdown tool is really just a great way to challenge yourself, challenge your knowledge, and to really sort of test yourself, a different way of studying that's outside the traditional methods of study. We also have this Clerkship tab available. This is really an invaluable resource that brings together all of the clerkship specific content from across the AccessSurgery site. It brings it all into the one place here, this one tab in AccessSurgery. It includes text references, case files, and videos on some of the essential concepts and procedures that clerks may observe or assist in during their rotations. This Clerkship tab has a set of content that has been selected by our editorial board. It is to provide the proper foundational education for clerks in their surgery rotation to help them succeed both in their rotation as well as on their exam. It includes cases as well, and you can see here some of the different content that is available to clerks. And finally, we have this Patient Education tab, and this is a really great resource where we've provided these patient education handouts in multiple languages by adult, medicines, and pediatric advisors. It's also browsable alphabetically. And these handouts are available as PDFs. However, if you are signed into your My Access profile, You can also customize this PDF to include your office information or logo, contact information, as well as any special instructions for the patient. And you can save and open a customized PDF patient education handout. This is a very valuable resource for our users in the clinical setting. And finally, I would like to point out this support tab at the top in the black ribbon, including this user resources icon. This will take you to a separate website. This is the Access User Center. This is where we provide all of our videos, tutorials, user guides, flyers, brochures, all the material that really helps you to make full use of AccessSurgery, as well as the other sites that might be in your subscription. You can navigate by medical products, including AccessSurgery. And here is where you can see all of the content that we have made available, including a LibGuide. We have a surgery-specific LibGuide. We have a content map for surgery clerkship. So here we can see our content on AccessSurgery mapped to the latest educational standards. So here we see the content map for surgery clerkships, adapted from the American College of Surgeons and the Association for Surgical Education Medical Student Core Curriculum. And so you can see our core topics such as abdominal pain, the content that we provide in the site related to that core topic, and the resource that that content is pulled from. Here we see some of our other areas, and this is downloadable as a PDF file. This is a great resource for faculty. You'll also see here this AccessSurgery Residency Distance Learning Content Map. And so here we have we've mapped our resources for learning remotely, especially during the time of residency. So you can see the rotation. So here we have the acute, critical care, trauma, surgery rotation. Here we have our individual topics, the format that we provide that content in. So that's our content, the format, and then the resource that it is pulled from in AccessSurgery. Again, a great resource for any clerkship or residency directors. We have more information about creating your My Access profile, including remotely if you need to. More on using the search tool, the drug monographs. Here we have a link out to our online interactive user guide. That's the LibGuide. You'll see how to link to content for any faculty in attendance. This goes into more detail about linking to our content using durable URLs. You'll see our video on hypothesis and using hypothesis. More information about CME for any of our practicing physicians in attendance. So we do provide a lot of great content here on the Access User Center, including we also have this Contact Us page. So this is really the primary way to get in touch with user services. That's all of us trainers. And that is userservices@mheducation.com. You can see it highlighted on screen. We do strive for a 24-hour turnaround time. I'd like to thank you for attending today's session. We would love to gain your feedback on this session. So please take just a moment to fill out the brief survey that appears after we disconnect. If there are any chat questions that are remaining, we will be sure to get to you or follow up with you in an email if we are unable to before we disconnect. Again, thank you for attending this session today on AccessSurgery, and please let us know if you have any questions at userservices@mheducation.com. Thank you all, and take care and have a great day.